One of the next steps I like to take for my own painful hips, as well as patients that I treat that are starting to have this irritation, is trying to improve the position of the femur in the joint socket, as well as just doing an overall posterior mobilization, which sounds really wordy and fancy, but it's not. If you think about the hip as a ball and socket joint, so this is the ball, this is the socket. If that tissue is getting impinged, that means that that ball is a little bit more forward in the socket. Think about my nose and the rest of my body facing out this way. So what happens then is, you go to flex or bring your knee up and it pinches all this tissue right here. So it just feels like it's really jamming forward in that socket. So what can feel better is if we think about pushing that femur back. So it's more centered in the socket. It takes a lot of pressure off of these agitated tissues here. And it just gives it a chance to breathe and get more nutrients and fluid, flush out inflammation, whatnot. We want to think about trying to push that femur back. So I've got two main methods that I use for this. One is laying on your belly and having something in that hip crease to push the femur back. This doesn't feel as gratifying as if someone is pushing on your femur, which is what I'll usually do to my patients. It feels amazing, but it is a pretty good self-help DIY work for trying to get that femur a little bit further back and at least take some pressure off of that agitated tissue. So what I like to use is a fairly firm towel roll. If you happen to have a half foam roller where it looks like a little half moon, that can work really well, or just something that has a little bit of firmness to it that can push back on that hip. But again, the towel roll is a really good fix. Most people have some sort of firm towel. You roll it up, you fold it, just find something that works for you. So if I have my hip crease right here, I want to place that foam roller or that towel roll just below that point. So it allows that femur to push back this way, right? If you put it too far up here, it's just going to push on that hip crease itself, but it's not going to move your femur, which is the ball of the ball and socket, okay? Now, you want to lay on a firm surface for this. If you lay on a squishy bed, the bed is just going to absorb the towel roll or the half foam roll, and it's not going to do anything for you. You want to be on a firm surface, which can be a little bit more uncomfortable for the rest of your body. Find other pillows, towel rolls, something to just give you a little bit of comfort there, but just make sure that there's a firm surface on the other side of this towel roll. Okay, so what that looks like is you're going to lay down on your stomach. You have your towel roll just below that hip crease. Again, my hip crease is right here. This is just a little bit more towards my toes. And you're going to either stay up on your elbows like so, or lay all of the way down. Now from here, you can think about twisting over towards the painful side. So I'm thinking about rolling towards the camera, towards that towel roll, and it's allowing that towel roll to push my femur more towards my butt. That is taking pressure off of those front tissues that are pinched and agitated. Now here you can rock on and off of it if you want, or you can just stay and hold on to that. Sometimes I'll push with my opposite hand over here just to push my body over a little bit more because it's a painful side, right? And it feels a little bit weird to go towards a painful side. And you're not trying to ram on it, but you're just trying to encourage a little bit of pressure on that long bone of your thigh just to take some of that pressure off. This should feel good for the most part. It might feel weird to feel that agitated tissue move around a little bit, but at the end of the day, it should feel like you're taking pressure off, which is good. If it feels like you're putting too much pressure on, that towel roll might be too far up and it's sitting on those agitated tissues. Try moving it down just a little bit there, and that can help. Okay? So that's step number 1 for taking some pressure off of those front tissues. Let's move on to method number 2. Okay, so method number 2 is using a really strong band to essentially pull that femur back. This is usually done sometimes in a standing position, but I usually do it in a half kneel position with my people and with myself, just because I think it's a little bit easier to kind of get that grip. So I have a fairly durable, stretchy band here. This is like a cotton one, but the ones that I've seen the most often and that I've used the most often have been the really thick rubber ones. These ones you'll sometimes see in a gym to help take weight off of, a pull-up or something to that effect. They come in different thicknesses, different weights. A lot of times you just need something that says it does about like 15 pounds of pressure. I don't have one of those ones personally because I always have them at the clinics or the gyms that I work at. But a friend gave me one of these cloth ones a while back when I was having hip issues again. So this is what I'm working with. If you only have the resistance bands that you have traditionally used for PT, like the yellow, red, green, or something to that effect, most of those will be too stretchy and not firm enough. So what I would recommend is if those are the only options you have, maybe you get some jeans and you kind of like tie them in a loop to something, or you get a regular old school belt and you just cushion it with a padded up washcloth where it's going to go on your hip just to take some pressure off that way. Something that just has a little bit more firmness to it rather than more give and stretch. Now, what I have traditionally done is had someone close one of these objects in a door, or you use a really heavy weight. Or alternatively, if you have a heavy kitchen table or a couch or something that has like a good post to it, like some people have used the water pipes in their basement, that works fine too. Just something with some sturdiness to it where you're not going to knock it over. So what I do is, for me, I'm going to use this dumbbell. I loop my band around there. Because this one still has a good amount of stretch to it, I double it up. So we've got 2 of those there. You're going to then face away from your anchor. So let's say my right leg is the painful leg here. I'm going to put that into my double loop here. Again, it's going to go up high in my hip crease, but not on my hip crease. It's going to go just below. So if I were to be sitting, it is technically on my lap. Okay, so this leg stays bent and down. The other leg goes up tall to give you that balance. And again, you can use the wall or something for some balance here as well. So now you can see that this is getting pretty taut and it's pulling behind me. Now, again, the goal here is to offload those agitated tissues in the front and move that ball in the ball and socket a little bit more back. Okay, so I want you to feel like this is trying to pull your whole leg backwards. What I don't want you to do is to allow your pelvis to dump forward. See how I've got that big arch in my back now? That's going to change the angle of that hip joint, and it's going to be less relieving on those agitated tissues. So I want you to think about standing up or sitting up tall, where now your ribs are stacked over your pelvis, and you're almost doing a little bit of a pelvic tilt here, where you're tucking your tailbone. I don't want it to be a huge tuck here. Then you're going to feel a crazy hip flexor stretch, but that's not our goal. I just want you to be nice and upright. And if you think about your pelvis like a bowl full of water, you're keeping the water in the bowl. You're not spilling water out the front, and you're not spilling water out the back. You're just up nice and tall, and you shift weight into that front foot. This will give more pull on that femur. And then you can back off a little bit and then go again. Generally, I have people hold this for 30 seconds to a minute, depending on their comfort level. If the knee that is down feels really aggravated on a hardwood surface, throw it on a pillow or a towel roll there just to give it a little bit of cushion. That does not take away from the exercise. The goal is to have that pull backwards. When I was in my most painful hip state, I did this daily. I did it after I did my cycling. Sometimes I did it before. And then I would try to sprinkle it in throughout the day, but that was only manageable because I worked in an outpatient clinic where I could get away with that. But it felt so good. I felt like a junkie with this exercise. I was just trying to get that pull backwards all day long, because I know that as I was working with people, it was getting jammed in the front and it felt worse the more I moved around. But this helped to take some of that pressure off the tissue. Now, between the pull with the band and the towel roll on the floor, you do not have to do both. They are just both options of the same technique or idea of offloading those front tissues. So if you prefer one over the other, just do that one. As long as you're taking the pressure off of those tissues and reseating that femur a little bit, you're in good shape. If you want to do both, you absolutely can. Just remember, the main idea is take a little bit of pressure off the front of those tissues, be able to relax into it, and not have too much pressure right on the hip crease. You want it below the hip crease. If it's above the hip crease, now we're doing the opposite issue, where now we're almost jamming that femur more forward in that socket. So play around with it. Again, the idea is take the pressure off to decrease pain. Good luck.